Hello, my name is Anisha Krishnan, and today I'd like to discuss CAR T cell gene therapy. Specifically, I'd like to discuss the treatment Kymriah. Kymriah, developed by Novartis Pharmaceuticals Corporation, was the first gene therapy to be approved by the FDA for use and distribution within the United States of America on August 30th, 2017. It's a novel gene therapy for patients under the age of 25, pediatric and adult alike, who suffer from acute lymphoblastic leukemia, also known as ALL, large B-cell lymphoma, follicular lymphoma, and two types of non-Hodgkin's lymphoma, who either relapsed or did not respond favorably to other leukemia treatments. It's a CAR T cell therapy, which stands for chimeric antigen receptor T cell therapy, which is a type of gene therapy that involves isolating blood cells from the patient's blood or a donor's blood and inserting a gene into said T cells that makes them produce a cell surface antigen receptor that can target and isolate cancerous cells that express CD19. The reason why that the gene for the chimeric antigen receptor is specifically there to target the CD19 antigen is because 80 to 85% of pediatric ALL diagnoses are B-cell precursor in origin, and they test positive for CD19. It's an antigen on the membrane of the cell, and it's typically there not just at the initial diagnosis, but also at relapse. What's important is that CD19 is not also expressed by pluripotent blood stem cells. So since it's just to normal B cells or B-cell malignancies, this makes CD19 an ideal target for immunotherapy. Both malignant and non-malignant cells, marking them for lysing and effectively eradicating the cancerous cells. For the intended recipients of Kymriah, patients who were running out of options or had received devastating news of relapse, it was an astounding option. 83% of patients who went into remission within 3 months of treatment, pediatric and adult, was in fact this astounding success rate, this astounding effectiveness that was noted and observed during clinical trials and clinical applications on actual patients with ALL that actually had Kymriah move through the licensure process quite quickly compared to other drugs or therapies that are typically available on the market that normally had to go through a very long, lengthy process that can take years, possibly even spanning decades. At the time, the currently available therapies included chemotherapy, which is cytotoxic and has an overall remission rate of 20%, targeted therapies with an approximately 43.5% remission rate, and non-curative palliative care. Even with those first two active options, maintaining remission in patients was difficult with these options. In comparison, Kymriah might seem like it's almost too good to be true, which leads me to my next point, the side effects. There are a handful of serious risks involved with using Kymriah as a therapy, some of which can be severely life-threatening. According to the FDA report, 79% of patients reported cytokine release syndrome, also referred to as CRS, a condition where the rapid and, from the body's perspective, truly excessive immune response made by the engineered T cells who are responding to the CD19 in the cancer cells causes a flood in the body, a cytokine storm, which floods the body with signals for a severe inflammatory response to what we know is actually very little, and can include severe nausea, slowed breath, a fever of 100.4 degrees Fahrenheit or higher, chills, diarrhea, severe muscle or joint pain, low blood pressure, dizziness or lightheadedness, and anaphylactic shock, all of which can be fatal. Neurologic toxicity was also reported in 65% of patients who received Kymriah during clinical trials. The symptoms for these can include altered or decreased consciousness, delirium, confusion, agitation, seizures, difficulty speaking and understanding language, and a loss of balance. And this may be fatal. One death within 30 days after having received Kymriah involved a grade 2 CRS, and it was suspected to have a relationship with the usage of Kymriah. Shortly after that, there was a series of abdominal and organ injuries and conditions, and finally, it ended in a grade 4 cerebral hemorrhage that did in fact take the patient's life. On top of this, side effects such as febrile neutropenia, where a patient develops a fever while having a low white blood cell count, cytopenia, an abnormally low overall blood cell count, and general infections occurred in 38, 53, and 59% of patients, respectively. However, there are appropriate risk mitigation strategies in place to handle these side effects should they occur in patients. To avoid severe adverse events in a patient population that is already so vulnerable, a few requirements were established. Number one, healthcare professionals dispensing Kymriah must be certified through a live training program and knowledge assessment. Number two, all cases of cytokine release syndrome and neurotoxicity that is suspected to be related to the usage of Kymriah must be reported. Number three, documentation must be maintained at all times, ensuring that protocol is followed as instructed. Number four, continual audits are to be conducted to ensure training procedures of healthcare professionals who are dispensing and administering Kymriah are being undertaken appropriately. And number five, at least 2 doses of tocilizumab for dampening the effects of CRS, should it happen, must be available at sites where Kymriah is administered. In fact, in clinical trials involving treatment with CAR T cells, 69% of patients had a full resolution of CRS within 2 weeks following 1 or 2 doses of tocilizumab, which is also referred to as Actemra. Other requirements exist, such as informing the patients of the importance of returning to their treatment site upon developing any symptoms that might resemble CRS or any other adverse reaction to Kymriah. The side effects may be severe, but they can be mitigated with the appropriately provided risk mitigation strategies. And for a condition with a sub 50% 5-year survival rate in children who have relapsed, and a sub 20% 5-year survival rate in adults who have relapsed, Kymriah is a strong, viable, and revolutionary option for these patients. Thank you for watching.